the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. Can your heart handle the haunted house? We have an old saying, you gave me a heart attack, right? Well, that happens after someone's been startled. So how does being scared actually impact your heart? Joining us this morning is Baptist health cardiologist, Dr. Anthony Fletcher. Happy Halloween, Dr. Fletcher.
Halloween.
Thanks for being here. Yeah, this is certainly a timely topic and very interesting. So the question is, can this really happen, or is it just a saying? Can someone really be given a heart attack?
Well, Allison, absolutely yes. When people are frightened or scared or even significant emotions, there can be a release of adrenaline. And adrenaline is a stimulant to the heart that can cause the heart rate to go up, the blood pressure to go up, and this can trigger an event, especially if you have an underlying heart condition or you have predisposing situations that put you at risk for heart disease.
So who is at risk here for fright or stress when it comes to their heart?
Well, you know, the individuals who, for instance, have had a previous heart attack, or individuals who might have a rhythm problem where the adrenaline can stimulate that rhythm. If someone has hypertension and it's labile or brittle, that can elevate the blood pressure, and that can also trigger certain issues, even sometimes result in a stroke if your pressure goes high enough, or precipitate you going into congestive heart failure.
So if you have any of these, you probably need to stay away from the haunted houses.
Absolutely.
Yeah, be extra careful out there. Okay, what are some of the facts when it comes to heart disease?
Well, you know, the major fact is that coronary artery disease is the #1 reason that people still die in this country. And one person dies every 39 seconds with coronary artery disease or heart-related conditions. And so this is certainly our major concern. Now, most people don't have heart conditions, and they're going to do just fine and enjoy Halloween and have a great experience. But we certainly want to take this as an opportunity to remind people to look at the risk factors, know your risk factors, and go to your doctor and be screened for underlying conditions that might put you at increased risk, not just for trick-or-treat or Halloween, but any day-to-day activities that might result in stress or situations where your adrenaline can be released.
Yeah, certainly important information for you to know. Okay, since it is a Halloween, let's look at some tricks and treats for our heart.
Well, absolutely. And when we thought about this, we wanted to talk about, you know, what can happen. So the tricks for Halloween certainly are things that high blood pressure, for example. So if you have high blood pressure, that's going to be a trick. If you eat certain foods that are high in salt or high in cholesterol, high in sugar, you know, these are certainly conditions that put you at risk for coronary artery disease. Obesity, lack of exercise, we've talked about that many times. Avoiding certain stressful conditions that you can control. Stress releases adrenaline, and again, that puts you at increased risk for that. So are people with diabetes or people with known congestive heart failure, people who've had myocardial infarctions, people with known arrhythmias, and positive family history. I think that's just so important. We can't emphasize that enough, that if you have a history of heart disease, again, you should be suspicious and be screened and checked.
And before we're out of time, some of the treats.
Well, the treats, absolutely. Well, relaxation, you know, doing things that help you decrease your stress level, eating good healthy foods, vegetables, low-fat foods, low-sodium foods, exercise up to 150 minutes per week, smoking cessation or avoiding secondhand smoke, and lean body mass. You know, you want to maintain a good idea of physical health. And get your checkups and know your numbers. Those are extremely important.
Yeah, important information on this Halloween. So if you have any of those conditions, be careful. Maybe you stay inside on this Halloween and not visit the haunted houses. But if you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST. Dr. Fletcher, as always, thanks so much for being here.
All right, happy Halloween.